How to take care of your dental bridges. Practice good dental hygiene. Clean the dental bridge every day to prevent tooth decay, bad breath, and gum disease. Clean under the false tooth every day. Keep the remaining teeth healthy, as they serve as the foundation for the dental bridge. Do regular checkups. Brushing and flossing. Brush twice and floss daily. Floss using both hands, moving the floss back and forth under the bridge. Floss the bridge completely from one end to the other. Diet and eating habits. Eat soft foods or food cut into small pieces until you get accustomed to the dental bridge. Eat a balanced and nutritious diet for good general and dental health. Avoid sticky, chewy foods, for example, chewing gum, caramel, chocolates. Minimize use of the side of your mouth with a bridge. Shift the bulk of your chewing to the other side of your mouth. Avoid chewing hard foods such as raw vegetables,